How is a pancreatic FNA biopsy performed? Imagine trying to get a tiny piece of a puzzle deep inside your body. That's what a pancreatic fine needle aspiration biopsy is all about. It's a minimally invasive way doctors collect a small tissue sample from the pancreas to help diagnose conditions like pancreatic cancer. Because the pancreas is tucked deep inside your abdomen, the procedure relies heavily on imaging guidance to be precise and safe. First, the patient usually receives a sedative through an intravenous line to help them relax. Sometimes, local anesthesia is also used to numb the area. The doctor then sterilizes the skin over the abdomen or mouth, depending on the approach. Since the pancreas is not easily accessible, the procedure involves two main methods of guiding the needle. One common way is endoscopic ultrasound guided biopsy. Here, a thin, flexible tube called an endoscope with an ultrasound probe is inserted through the mouth into the stomach or the upper part of the small intestine. The ultrasound helps the doctor locate the pancreatic lesion. Once identified, a very thin needle, usually 22 gauge, is passed through the wall of the stomach or duodenum directly into the lesion. The other method is computed tomography guided biopsy, where real-time CT imaging helps the doctor insert the needle through the skin into the pancreas. This method is especially useful if the lesion is in a hard-to-reach area. Once the target is located, the needle is advanced carefully into the lesion. The doctor moves it back and forth to collect cells or small tissue fragments. Suction may be applied with a syringe or a gentle pull technique used to help draw cells into the needle. Because the needle is very fine, typically 20 or 22 gauge, it minimizes trauma and reduces discomfort. After collecting the sample, the tissue or cells are expelled onto slides or into containers for microscopic examination. A cytotechnologist or pathologist may assess the sample immediately to ensure it's adequate for diagnosis. This step helps improve accuracy and reduces the need for repeat procedures. Following the biopsy, the patient is monitored for a few hours to watch for any complications such as bleeding, infection, or inflammation of the pancreas. The entire process usually takes between 20 and 60 minutes, including preparation and recovery. In essence, a pancreatic FNA biopsy involves guiding a tiny needle into the pancreas using advanced imaging techniques, carefully collecting tissue, and analyzing it to determine if cancer or other abnormalities are present. It's a vital tool for accurate diagnosis and planning treatment. While generally safe, it requires skilled operators and careful patient monitoring to keep risks like bleeding or infection very low. Always remember, if you or someone you know needs this procedure, it's best to discuss all questions and concerns with a healthcare professional who can tailor the approach to individual needs.